Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
The reason why I mentioned food on the cruise ship was because that got me curious. I'm like, you said there was no flare-ups, no PANS flare, no behavioral flares. So we said, I was like, all right, let's see where the gut is. And when the lab tests came back, that's when we saw that, the microbiome of a child labeled as being on the spectrum, it is so rare to see everything within range. And the lab test showed us that the microbiome was within range.
Yeah.
That makes a lot of sense, eating out for a whole week for all meals.
Yeah. And we do eat out quite a bit. I would say maybe like once or twice a week we go out. And maybe there's cross-contamination. I mean, they're not celiac or anything, so it's not, but I mean, they're not eating like a bun, a gluten bun. So there might be cross-contamination, but at this point, we don't see Andrew. Yeah, if he would, when he was like 4 or 5 years old, if he got a taste of something he shouldn't have, he was hyper for 2 weeks.
For 2 weeks.
Oh yeah. Oh yeah.
And he's still like, you go to a birthday party and they have the gluten-free cupcakes and he sees a piece of chocolate cake, you'll see him eating it in the corner. Like,
oh, Rob gets found him in someone else's birthday party.
Yeah. He's crafty. He'll get what he wants, not that he knows it's gluten-free or not gluten-free, but we do our best to try to monitor it.
Last year they were at the jump park and Rob said he was looking around, he couldn't find Andrew.
I thought I lost him.
Andrew had gone into a birthday party that was there and he asked for a piece of cake.
Oh,
and
they crashed
him.
Yeah.
He totally partied.
And the mom goes, he asked me so nicely, I just gave him a piece of cake. I said, oh, thanks. I said, I thought I lost him. Thought I had to make the call home saying I'm coming home with one less kid.
Oh my gosh.
But, yeah, he just sat down at a birthday party.
So they're getting there. They still need work. But
it's a long road.
We see when you sat in here last, and I know we have still a lot more work with Grant, but when you were talking about, you had said something a couple weeks ago when we spoke, and we were talking about focus, and you were like, well, what kind of focus is he at? I said, well, the goal at school is 15 minutes right now, and he's doing that. And you were like, oh, I expect it to be an hour. And I was like, well, no, that's quite a while off. He does have great focus on what he wants,
right?
But school directed. And I remember you said, oh, I can see his path. And I was like, do you want to share? And you said, we've got to get him ready for the SATs and ACTs. And I was like, oh, okay. So that path. So, it was such a good thing to hear because there are very few times where I've heard you say, well, let's try this. And it's always like, oh, we're going to do this. And when you were like, oh, I can see his path. And I was like, oh, good. At least one of us has that foresight. But, and I just kind of like look at him now after you said that. And I'm like, okay, so we've got to get this focus going, but he can do it. He's going to be able to do it.
Yes, yeah. He has the smarts for sure. I mean, the reason why is, other than clinical experience is being an autism mom myself, false diagnosis, but being an autism mom myself. And I remember Brian's trajectory, how it progressed. And at what point that he made that cognitive leap, I still remember he was 11 and a half. We had to hold him back a couple of years, so, I mean, he was in a wheelchair, anywhere near other kids in public, he had to wear a mask. So it was kind of rough, and he would have been bullied in school, being weird. So we had to hold him back for a couple of years until he walked a little bit better. He was still, during gym, his left leg would drag behind him. But, like you mentioned earlier, Kate, you need to support them, but you also need to push them a little bit, so just so that we see the best in them. Yeah. We did that. We did the same. And I remember 11 and a half years of age, his cognitive just took off. And the last piece for Brian was actually mark-ons. Back in the day, no one used to check. It wasn't standard to check mark-ons for children because there wasn't any research. It was assumed that children would just recover. And I guess autism, PANS, PANDAS, special needs children were not considered in that research group. And I started to screen mark-ons for all the children in my practice after this experience with my son. I mean, cognitively, he went from mom, can you get my stuff, please, to mom, can I request you to grab my paraphernalia? So he went. So I just did a double take. That's how I still remember that. Since this was me, teaching him, Brian, look to the left, look to the right, look to the left again. No cars coming, cross the road. Brian, you have a play date with Madison. You have to say hi when she comes in. I mean, this was me teaching him, how to have a simple social interaction, on a play date. So from there, 11 and a half, fast forward to age 14, he's speaking at the New Jersey Lyme Convention, along with Congressman Chris Smith. And then fast forward to age 16, he's speaking at Harvard, at Harvard Spalding. They invited him to speak about his experiences at the Children's Rehab Center. So, we had physicians, physicians, nurses, parents in the audience that were listening to this little guy, go over his experiences.
Do you think there's something there with puberty too at that age that they might be able to make a leap like that, or
that's a good question, right? No, that's a good question, Kate. Now, Brian's puberty was back and forth. We had early puberty where his voice changed in 4th grade.
Oh.
And we started seeing this happens with late awareness or incompletely treated mold exposure.
Okay.
It disrupts your hormones, especially when there is PANS as well, PANS and Lyme co-infections. And then we had a late puberty. And then we had to go in with the growth hormone shots. And, at one point we were doing 3 shots a day just to balance out the hormones. We had a really fantastic endocrinologist at that point. And then, teen years came in and we started having typical teenager, angst issues with Brian. And, we were butting heads and he's like, I'm going to do it on my own. So he learned how to assemble a shot, from 2 different vials to mix them together and make his medicine, and then make a shot in a syringe, pull out whatever his prescription was and inject himself intramuscular. So he just learned he says, I'm mom, you're cranky. I don't want to deal with that. I'll do it myself. All 3. So yeah, I'll do it myself. So he actually did them for a couple of years on his own. So that's how we manage the puberty. But the goal always is to get the body clean and clear of all triggers, because PANS is autoimmune. It stays with you, for the rest of your life, like any other autoimmune condition. You can take asthma, allergies, they're always with you. You have to manage them. So PANS is certainly manageable, right? With minimal herbals, like Brian takes about 5 maintenance supplements. I tell him every other day, but he likes to take them every day. It just, he likes how it makes him feel. So the immune boost, you must have heard me say that PANS children should not be boosted. Do not take boosters. Don't take herbal booster. Vitamins is okay because the body will excrete the ones that are not needed. But, I always advocate, do not take things like echinacea, elderberry. Don't boost up too much turmeric. So the only natural immune boost that a PANS kid can handle is puberty.
Interesting.
Right? So once that happens, that's when you'll see a big leap. Yes, that I believe that was your
Right.
question. Yes.
Yeah, yeah. We're definitely not there yet. Like I said, they're not even 10 yet, but yeah, then I remember you said at puberty too, I guess it might be with the added testosterone or something, grants, hand development and everything should progress, his grasp. And
Yes.
so we're gonna wait for that one. But he is making progress.
Yeah,
Just
they get good reports.
Yeah.
I would say 95% of the time from school, they had a great day, or
Mhm.
you know, they had one needed support at one point, but other than that, had a great day. You know, like I remember our first test review. Like I was in my office and Kate was at home, and like you were going down, and like everything was red, and I'm like, how can these guys have so many issues? And you know, how is, you know, like it was unbelievable how many, you know, things were in the bed. If you brought your car in like that, you might as well, you know, scrap it, because there's no way you're going to get it back. But and then in our last call, you were like, I can't believe the progress they made. Like I've never seen that before. So,
Mhm.
and when you see the results in everyday life, you know, because they're starting to do things on their own, getting dressed by themselves. Andrew's, you know, I'd say he's 95% showering by himself now. I mean, I'm so used to just giving everyone showers. Like Charlie will walk in and I'm like, come here. He's like, I don't need you to help me with the shower. You know, you're just used to running them through like cattle into the shower. But like they're starting to do a lot of that stuff on their own as they heal.
And you know what's interesting is Andrew even watches out, because we're just used to them being so concerned about themselves and, you know, their wants, needs, especially wants, and that, you know, then their needs. And he really kind of watches out for his little sister. The other day she was trying to climb on like a shelf and get something off of the second shelf. And he goes very dramatic, he's like, no, Lisa, stop that. and he called mom. And you know, I mean, he'll go down, but I mean, they're big kids also. He just hit 5 foot, whereas almost a men's 10 shoe. He's a big kid. And, you know, he just went down and I said, Andrew, you can just go grab her. Like, it's okay. He's kind of like the gentle giant, but I mean, that kid is 100% muscle. So, you know, he's watching out for her. And she'll want to play with him, and he does.
Yeah. I'm actually speechless. You know, I don't know what else to say except, you know, I'm so glad you guys were able to share this story today.
Yeah.
It's going to be very inspirational.
We're glad too, because you don't hear it from a lot of people.
Right.
Yeah. And we've been in the you don't know what you're going to do stage, you know. Like I said, I swear I remember, I probably can look back at my screenshots, because I probably screenshotted your name off of a Facebook post and emailed it to myself to look, you know, to look into you. But that's how I found it, on like a support group, trying to see, you know, what other families have done and, you know, see progress. Because when you talk to your regular doctor, they have, or even people that are in the medical field in our families, they have no idea what to do.
You know what? Actually, that is because we do have a lot of family in medical, and that is something that they see the kids, they've seen where they are, but you know, they don't really bring it up. They don't really talk about it. And they see them getting better, but you know, they don't really want to hear the answers.
That is so interesting. Yes, I would agree with you. I've heard that from other parents. I've heard that from physicians in my own friend circle.
Yeah. I mean, they just like pretty much stay away from it.
Yeah.
No questions. They don't want to hear it. Like
a doctor, you know, I can't read those charts, but I'm a problem solver, and I'm going to just take bits and pieces that I can, everything I can absorb, and, you know, sift through it and make decisions. And not all of them we did were good or worked. We've tried a lot of things that we've talked about, you know, on our calls, that, you know, some people get results, and every kid's different. Some people say it's one thing that did everything. But, you know, I was going to say, since we started with you, I've seen it on paper. Not that I really know exactly what it is, but, you know what Lyme disease is, you know what mold issues are. I mean, I look for water spots, like, you know, it gives me anxiety now if someone spills a cup of water on the floor, that, there's going to be mold and we're going to go backwards. But seeing the paperwork to go with it and seeing the results, you're making progress and why. And I know we talked about that, because both boys had the Lyme, which I don't think they got from a tick, but whether it was a mosquito or however they got it. I watched a documentary, I think it was on Amazon or Netflix, about the Lyme disease, the silent epidemic.
Yes.
And I mean, the poor people in there that got Lyme disease, and it just crippled their life. And that these guys have it, and now it's getting better, and you're seeing progress. It's amazing.
I think the other thing that people are talked into, because I knew this was going to come up, when the boys were 2.5, I just took Andrew to a genetic counselor, and my background was in genetics. So I'm like, you know what, this one, that people are going to be like, oh, well, there's 2 of them. There's probably a genetic component to it. They ran a whole panel on him. The only thing that showed up was a deletion on a gene for hemolytic anemia. And I'm like, okay, you guys, let's cross this off the list. This is not where it was. There's no genetic component here. But, they were not severely preemie, but they were too preemie for what their bodies couldn't handle it. So, I mean, it was just like their chiropractor says, perfect storm. Oh, you know what? I also didn't mention multiple rounds of antibiotics between 1 and 2. 3-4 rounds for each boy.
That would probably explain why their gut biome is so bad, or was so bad.
Yeah.
Not that I'm an expert, but just kind of makes sense that that's what it kills. So is the bacteria.
Yeah.
And like I said, we tried. Grant's in the H-spot right now. He loves the H-spot. He gets his iPad in there and he's in there. We dive as much as possible. We do saunas. They love the sauna too, probably because they get an iPad.
And they don't get, let's rephrase this. They don't get iPads all the time, but when they have to do something, like when they're sitting in a sauna for a half an hour, or they're sitting in an H-spot for an hour and a half, then they do.
Yeah. So
see, now it makes sense going in the H-spot. I had explained about aerobic infections, which we found, right? When we were running labs, like, I mean, if you give super oxygen to living microorganisms, what happens? They grow.
Yeah.
So now is absolutely fine for the H-spot. So there is, I get many parents that have tried everything or a lot of things like you guys had prior. And when we, and they're fully convinced, nope, the labs are going to be nice and clear. We've put in a lot of work. And then we see, Rob, you said everything was red.
Everything.
Yeah.
But, and we've spent a lot of money. We're probably in the 7-figure range and trying to treat them over the last 7 years, because there's 2 of everything. So I would say the results based on what we've spent with you are probably the best gains, and we've made the most progress in the last, whatever it is, year and a half. But yeah, we tried it all. And, as parents that love your kids, I think you have to. You can't say you didn't try, it might not ever be perfect, but if you can look back and say you did everything humanly possible within your means, then I think you did your best as a parent.
I think one big takeaway that I wish, anyone listening to this, that I wish someone would have told me initially was, the therapists are all going to be great. The OTs, the speech, fine, whatever. But if you are not healed on the inside, it's like dog training. You don't want robotics out of your kids. You don't want them to have to, do this goal and get it 80% of the time for, 2 weeks consecutively, 4 to 5 trials. That's not what you want. You want them to understand. You want them to, have their own feelings and, do things because that, they understand it. And so if you're not healing from the inside and just going to therapy, you're going to get minimal progress.
It's funny you say about the dog training. So when they were younger and they were in ABA, they taught Andrew and Grant how to hold hands.
Yeah.
Right. Which when you had 4 kids under 4 years old, that was a great tool. But like today we went to the fire station here, had a big thing where the kids, Andrew was spraying a real fire hose off a fire truck. And Grant wanted to hold my hand still. And I'm like, hey, you don't need to hold my hand. You're standing right. But he's still reaching for my hand. So he has that ingrained in him that he should be holding my hand.
That was like the first thing they taught them for safety. And we're going to rephrase that for kids. That was 4 kids in 16 months. So we had a 1-year-old when the triplets were born. But yeah, they will still, like, their 4-year-old sister wants to hold my hand, and now Grant's coming to take it. So, I mean, it is a good safety, but,
it's not required.
No, it's not required. Yeah. They can be on their own.
Yes. Yeah. That's part of the deep programming that happens, the robotic programming. That is true. What you say is very true. I hope those listening or watching pay attention to this, that, unless you heal and repair and regenerate the underlying issues, eliminate all the factors that have caused PANS, false diagnosis of being on the spectrum, it is not possible that any of the training you receive is going to stick long term, or it's going to become programming, like you just mentioned, psychological programming. You keep holding hands.
It's not just the learning part, the behaviors and the meltdowns. And I mean, Andrew, he can scream louder than anyone in the world. He's 99% done with that. But I mean, like, that kind of stuff has gone away. Like, where when you're going through it, it's a nightmare. And now you don't even think about it. The behaviors, because the behaviors are a lot of things that give a lot of people anxiety of bringing their children places, and we've always had a lot of kids. So, you had to watch multiple kids, and then the 2 that needed more attention, it made it even harder. So, going to stuff was work. It wasn't go sit with your friends and the kids go play when you have 2 that could walk away, or just, Grant used to like to escape. Our neighbor found him 2 blocks away. He got out one of the doors, and he found him on an intersection, right by a busy intersection, and he brought him home, and we didn't even know he was gone. And then we had to put special locks on, and now the door can be open and doesn't, he stays with you. So it's all that stuff that makes everyone, because it affects everyone in your family's life and what they can do, what you can do as a family, the stress levels. But the progress we've seen has been a miracle.
And you have to watch for when they're ready to move on. Like Rob said, Andrew's scream, he was 99% done. He still has that 1%. And that is typically tipped off by someone else who has an inappropriate behavior at school, an outburst, someone who does the echolea that just goes on and on and on. And, they try to shape that, and finally I had to tell them, wait, it's not actually Andrew's fault. That's annoying to you as a teacher. That's annoying to him, but he can't get out of the room. So I don't want to teach him that's okay, that he has to listen to it. That's him being normal, being like, no, I'm done here. This is annoying.
Yeah, but Andrew he had a couple weeks where he had a flare up, and he had strep again, right? So he had an infection we already cleared that came back, and then we saw the behaviors come back, and now we're seeing them go away. So it's amazing how these little things how did he get strep? From a kid at the park, a kid at school, a bathroom.
And it's going to be around. I mean, you can't do anything about it because they are everywhere. But you don't want to limit where they are, but you have to learn how to deal with it and, slowly work on their body internally, little by little.
Yeah.
Yes. Yeah. I like that. You do have to live your life. You guys are in the Midwest. So there is, the sports, the hunting, the lakes, the swimming, right? The outdoorsy lifestyle. You don't need to be afraid to go out and the fishing and hang out with the kids. Just maintain your precautions, expect the flare-ups for a week here and there, and it's all good.
Yeah, before I saw that test, I wouldn't even have thought of a flare-up. I would have thought of regression. Oh, we're going backwards. Why are we going backwards? And then you showed us, you compare the charts back and forth, and you're like, wow, that is, it went from green to high red now. now it makes sense why he's having these issues.
Andrew's flare, what I don't think I've even mentioned, because I think it was just like 10 days ago we talked to you about Andrew. And when he had that hyperness, he became more conversational after that. Like in the last 10 days, I was like, wait, hold on, that stopped. And he's talking better. He's communicating better. So, I mean, for him, I've seen that time and time again. It looks like a regression. It looks like something happens. He comes out of it and he has huge gains.
If he has huge gains when he comes out of it, then it's typically a die-off.
Yeah.
Reaction. That's what.
And he's, they're very different. Sorry, I know we're probably closing in on your hour, but they're very different. Also, that's the other thing. Grant, you can dump a bunch of supplements into, and he has very little gains. Andrew, we can never get to the full protocol. I can get to, like, if it's 10 drops, 7 or 8. And then, I'm like, you know what? But that is his tipping point. Otherwise, it has the reverse reaction on him. And I'm like, that's just how he is. He has a super high metabolism. And if I give him too much, he metabolizes it too quickly. And I'm like, but you know what? That's okay, because that's what his body can tolerate. And he's making the gains.
Yes, that's your point of self-regulation of the body, including the sensory integration component of self-regulation.
Yeah.
So,
the other thing I thought that I see is their physical abilities, like our daughters and sons are in soccer 5 nights a week, dance class, gymnastics. So I always drop them off, and then I take Andrew and Grant, and now Lisa comes with us, and we go to the trampoline park. We go on walks in the woods to give them physical activity. But like even at the trampoline park, which I highly recommend, because if you want to go to a place where kids are screaming and your kid, no matter what they're doing, is going to look like they fit in there, that is a great spot. That's why I started going there. But like when we first went there, they couldn't do anything. And now Andrew can do any obstacle course. They can climb anywhere. He's hanging off the basketball rim. And the same thing with Grant. Grant can get across climbing walls, with those weak fingers. Like he could never do any of that stuff. And, as their body heals, their physical abilities, trying to keep them in shape and, aware and involved in other things other than TV or an iPad. We've seen unbelievable gains on what they can do.
Mm-hmm. Swimming too. Yep. We got a pool 2 years ago. And Andrew will just do laps in it. Grant, if you take like his characters or dive toys, he is an amazing diver, and he'll be under there like 45 seconds. I'm like, are you okay?
Oh, wow.
He just holds his breath and comes up and dives again. Right. So, I mean, I think that's a good full body also, just to get all that input. And they do have very good physical capabilities.
Yeah. And they've gotten better, because they were not good in the beginning.
No, Andrew would run into the couch and be completely bruised.
Yeah, because, having Charlie the same age, and Charlie at 5 years old is scoring 17 goals in a soccer game, and his brothers can't, climb the ladder on the slide, to now where, they're jumping off the slide, and landing and going back up again. So yeah, as their bodies heal, we've seen gains in all aspects, and we try to, again, get them involved in stuff just like our other kids. They have a harder time with the structured. I tried coaching Andrew. It was hard because I was trying to coach 10 other kids at the same time. He did it 50% of the time. But on that kind of stuff, they can play at their will, and you see them progress, spending so much time and watching them grow. But it all has to do with the body healing.
Yes, it does. Now, herbals are called as supplements, but in reality, it's herbal medicine.
Yeah.
And what I've seen, personal experience as well as professional, is when you heal with herbal medicine, the gains will stay with you. Flare-ups, yes, because, PANS is autoimmune, but the gains will stick. They stay. So what you're describing is the left brain communicating really well with the right brain, the myelin sheath on the nerves, the fast conducting nerve fibers, that go with your safety awareness, body in space, is where your body is in space. Is it safe? What needs to be, and reaction time. also anticipation of what's coming next. Now, these are all very complicated algorithms to develop in the brain, sometimes known as muscle memory. And that comes when your body is healing from within.
Yeah.
And that will stay. That doesn't go anywhere.
Yeah. I even forgot the small ones. Like Grant is fabulous on a scooter. He'll be like, 5-7 miles an hour on the scooter down the street. Andrew learned how to ride a 2-wheel bike
this year.
That was training wheels.
Yeah, took the training wheels off.
And he's just started piano lessons.
Piano lessons.
Yeah. The teacher teaches piano and violin to our other two. And, she said, as soon as he is ready and can focus for at least 5 minutes, she said, I do need to teach him, because she said less than 2% of her students, she's got a lot of students, have perfect pitch. She said he has perfect pitch. So yeah, it's good. They're all around, they're healing. We still have a ways to go, but we've come really far.
Again, I don't know what to say, except just I'm very grateful that the boys are doing well and that you are here today to share your long journey. So, and I'm glad you mentioned that it's a process. There's no miracles. You have to put in the work. And when I introduced you guys earlier, I mentioned that every appointment, I have mom and dad both there. And
this is the first time we've ever been on the call together in the same room.
Right.
In the same frame, yes, but you're both always on.
I'm either in the car or at the office,
yes.
But yeah, it's important. And you see, like I said, you see the gains. So my advice would be start your journey with Dr. Dashore. You'll be happy you did.
So wasn't that just so heartwarming, so encouraging and inspirational? I'm so glad Rob and Kate were able to make it today to today's podcast. So, well, we shall end here. And I will see everyone at the next episode of Autism Uprooted with BioNexus Health. Take care of each other, keep smiling, and I'll see you soon. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.